P.D.U Government Medical College Rajkot, Department of Anatomy, welcomes you in the lecture of abdominal X-ray. Today we will discuss urogram and pylogram. Pylography is a radiological method by which the urinary tract is visualized. The radiograph thus obtained is called pylogram. It can be done in two ways depending on the route of administration of the radiopaque dye. First is the intravenous pylography, that is also known as descending pylography. It is a radiological study of renal parenchyma, pelvic calyceal system, ureter, and urinary bladder. Intravenous pylography is generally done for structural and functional assessment of urinary system. It is contraindicated in case of non-renal failure and allergy of the dye. For the preparation of the patient is kept drill by mouth for 8 to 12 hours before the procedures. Laxatives are given. Serum creatinine is done to confirm the functioning kidney. Again, history is confirmed whether patient has any allergy of the drug or not. And patient is asked to empty the bladder before injecting the dye. Before injecting the dye, scout film is taken. After the scout image, a water-soluble non-ionic contrast known as urograffin 60% or 76% or Conray 420 or Conray 280, which is selectively excreted by the kidneys, is slowly injected intravenously. We have to take care that the dye does not spill over the vein because it is quite irritant and may slough off the skin. Then skiagrams are taken at 1 minute and after that at the interval of the 5 minutes. Here we can see the first scout image of plain abdominal X-ray. This image shows the pelvic region. At 1 to 2 minutes after injecting the dye, we can see the shadow of the kidney because dye may have reached to the kidney. This image can be known as nephrogram. At 5 minutes, we can see the shadow of Calyces. Calyces are cap-shaped structure. We can see the major Calyces here. Funnel-shaped structure is the pelvis. This is the initiation of ureter. So this can be known as pelvico-ureteric junction. The same structures are visible on the another side. Ureter can be extended up to the urinary bladder. At 10 minutes, we can see the shadow of urinary bladder also. In addition to the ureter, pelvic-ureteric junction, renal pelvis, Calyces, and kidney. At 25 to 30 minutes, we can see the complete urinary system from Calyces to the urinary bladder. This is the image of pelvic region showing the urinary bladder. This is the lateral view. Lateral view is taken to confirm the position of pathological structure like renal stone. In this image, we can see the calyces, pelvis, and ureter on the right side of the patient. But at the same time, the calyces, pelvis, or ureter are not visible on the left side. In intravenous pylography, to assess the function of the kidney, dye should appear at the collecting system at the same time, but we cannot see the dye on the left side at the same time. Instead, we can see a shadow of renal stone. This is the prevesical renal stone. Second is the retrograde pylography. It is also known as ascending pylography. Retrograde pylography can assess only the structural pathology. It cannot assess the functional pathology of the kidney or urinary system. It is indicated when intravenous urography or CT scan urography cannot give proper result of the ureter segment. The preparation is the same as it is in the intravenous urography. For the procedure, before injecting the dye, a scout image is taken. Then cystoscope is passed through the urethra into the urinary bladder. Through the cystoscope, ureteric catheter is passed through the ureteric opening up to the renal pelvis. 5 to 10 milliliter of 6 to 8% sodium iodide dye known as Conray 280 is injected, which fills the renal pelvis. Once the renal pelvis are filled up to its capacity, it induces pain. At that time, we should stop injecting the dye and spot images are obtained of areas of interest. In the first image, we can see a catheter. That is the ureteric catheter which is passing through the ureter. Here, the image shows the dye injected through the ureteric catheter, which gives a shadow of the calyces and renal pelvis. In the third image, we can see ureter also in addition to the calyces and renal pelvis. So now we can read X-ray of pylography like this. This is a special X-ray taken by the intravenous pylography. It is an anteroposterior view where we can see the shadow of the kidney on both sides, renal calyces, pelvis, pelvic ureteric junction, ureter, and urinary bladder without any visible abnormality. For the retrograde pylography, this is a skiagram taken by a special technique known as retrograde pylography, where we can see the shadow of the calyces, pelvis, ureter on the right side without any visible abnormality. How we can differentiate the skiagram of intravenous pylography and retrograde pylography? In intravenous pylography, we can see the shadow of renal pelvis on both sides, while in retrograde pylography, we can see the shadow of pelvis only on one side. In addition, in retrograde pylography, we can see a catheter through which the dye is injected. This is how we can differentiate the skiagram of intravenous pylography and retrograde pylography. So this was about the pylography. In next lecture, we will discuss about the barium study. Thank you.